My name is Patrick King. I'm in Communication 101. This is my informative speech. I'll be doing it on the intubation process. Here's a photo ID. It's a badge. For this, I made a scenario. You're working in an ER and you get a call from emergency services that an ambulance is on its way to your ER. They have a male that was out walking with family and he passed out for no apparent reason, and he is breathing on his own for now and has a heartbeat, but it's weak and he's not doing good. So as a code comes into your ER, time is always of the essence. Mainly the longer the patient goes, if their heart stops and you have to start CPR in them, the brain needs oxygen, vital organs need oxygen, blood circulation. So all this stuff needs to be taken care of as soon as possible. Everyone has their role during this time, and you have goals of circulating medication, doing compressions to simulate the heartbeat, and breathing for the patient. If your job is the intubation, which is what we're focusing on, then you would have prepared your equipment before the patient got there in a short amount of time. You'd have your intubation tray set up at the head of the bed where the head of the patient will be. And for this, you would need a couple of main pieces of your tools, and that would be the laryngoscopes, these two pieces of equipment right here. You have your handle and then your blade, and right here is a little light bulb. They're LEDs, you can see very well with them. So this is a Macintosh, it's curved like an apple, Macintosh apple. This is a Miller, it's straight. Most of the time you use the Macintosh blade and it's easier to get. This is your ET tube, endotracheal tube, and this is what you actually put through their mouth, down their throat, into their lungs. It's got a balloon right here that blows up with air pushed in that seals the airway off and protects them from swallowing, spit, vomit, etc. During your intubation process, you're going to take your laryngoscope blade in your left hand. You insert it on the right side of the patient's mouth as their head is slightly tilted up and kind of looking back at you over their head. You insert on the right side, you scoop kind of to the left in the middle, and then you lift at about a 45-degree angle towards their feet. And that lifts the tongue out of the way and helps you visualize the vocal cords. At that point, you would take this piece here, this is the endotracheal tube, and you would slide it in the mouth like this. And as you're squatting down, looking straight down through here, she's looking there, then you would insert that through the mouth, through the throat, the trachea, and you would want to slip it right between the two vocal cords. They look like a little bird beak opening up when breaths are taken, and you just slip it right in between the two. There are several ways to check to make sure you had a successful airway intubation. First is the easiest is to just listen to lung sounds with your stethoscope, listen to the right and left sides to confirm. And the most reliable way is to do an X-ray and visually look at the ET tube in the lungs. You want to make sure it's not too far to the right or the left, but just above where the lungs split. And once that's done, as long as there's no CPR going on, you can hook the patient to a ventilator and transfer them to the ICU for further evaluation, hopefully to fix the problem. Intubation process with a good team that knows their roles and what they're doing is very swift, quick, and efficient. Thank you.